1. Birth control pills. These are used to prevent pregnancy, but they can increase blood pressure in some women. It's important to monitor your blood pressure regularly if you're taking them. Common birth control pills include a variety of brands and formulations, which can be categorized into combination pills and progestin-only pills. Here are some examples. Combination pills, estrogen and progestin, low estrin Fe. Sprintec. Yaz. Junal Fe 1/20th. Tri-Sprintec. Loestrin 24 Fe. Microgestin Fe. Yasmin. Avion. Zulane. Progestin-only pills, mini pills, Camilla. Erin. Heather. Incatia. Liza. Slind. These pills vary in their hormone composition and dosage, and the choice of which to use should be made in consultation with a healthcare provider to suit individual health needs and lifestyle. 2. Antidepressants. Medications like MAOIs and SNRIs help with depression, but they might also raise your blood pressure. Always discuss side effects with your doctor. Common antidepressants include a variety of medications across different classes. Here are some examples. Selective serotonin reuptake inhibitors, SSRIs, sertraline, Zoloft. Fluoxetine, Prozac, Serafem. Citalopram, Celexa. Escitalopram, Lexapro. Paroxetine, Paxil, Pecova, Brisdel. Fluvoxamine, Luvox. Serotonin norepinephrine reuptake inhibitors, SNRIs, duloxetine, Cymbalta. Venlafaxine, Effexor XR. Desvenlafaxine, Pristiq. Monoamine oxidase inhibitors, MAOIs, phenelzine, Nardil. Tranylcypromine, Parnate. These medications are used to treat depression and other mental health conditions by affecting neurotransmitters in the brain. Each class of antidepressants works in slightly different ways, and the choice of medication can depend on individual needs and side effects. 3. Non-steroidal anti-inflammatory drugs, NSAIDs. These are common pain relievers, but they can cause your body to retain water and sodium, leading to higher blood pressure. Common non-steroidal anti-inflammatory drugs, NSAIDs, include Ibuprofen, such as Advil and Motrin. Aspirin, such as Acotrin and Miniprin. Naproxen, such as Aleve and Naprosyn. Diclofenac, such as Voltaren and Cataflam. Celecoxib, such as Celebrex. Ketoprofen, such as Orovale. Indomethacin, such as Indocin. Meloxicam, such as Mobic. Piroxicam, such as Feldene. Mefenamic acid, such as Ponstel. 4. Decongestants. Used for relieving nasal congestion, but they can narrow your blood vessels, increasing blood pressure. Use them sparingly if you have hypertension. Common decongestants that can cause an increase in blood pressure include pseudoephedrine. This is a widely used decongestant found in many over-the-counter cold and flu medications, such as Sudafed. It is known to modestly increase systolic blood pressure and heart rate. Phenylephrine. Another common decongestant, phenylephrine, is found in products like neosynephrine. While research on its impact on blood pressure is less extensive than for pseudoephedrine, it is known to potentially raise blood pressure. Oxymetazoline. This is a topical nasal decongestant found in products like Aspirin. It can cause narrowing of blood vessels, which may lead to increased blood pressure. Nafazoline. Found in products like Privine, this decongestant also carries warnings for those with high blood pressure due to its vasoconstrictive properties. These decongestants can constrict blood vessels, making it harder for blood to flow and potentially increasing blood pressure. People with high blood pressure should be cautious and consult with a healthcare provider before using these medications. 5. Corticosteroids. These medications reduce inflammation, but they can also cause weight gain and fluid retention, which may raise blood pressure. Common corticosteroids that can cause an increase in blood pressure include prednisone, cortisone, and hydrocortisone. These medications can lead to fluid retention, which increases blood volume and subsequently raises blood pressure. Wait, there is more, but do not forget to hit the like button if you have found this video useful so far. 6. Immunosuppressants. Used to prevent organ rejection after transplants. But they can increase blood pressure as a side effect. Regular monitoring is crucial. Common immunosuppressants that can cause high blood pressure include calcineurin inhibitors. This class includes drugs like tacrolimus and cyclosporin. They are known to induce hypertension by affecting the balance of vasoactive substances such as endothelin and nitric oxide. mTOR inhibitors. Sirolimus is an example of this type of drug, which can also contribute to increased blood pressure, especially when used in combination with calcineurin inhibitors. Corticosteroids. These are well known for their hypertensive effects and are often used in conjunction with other immunosuppressants. These medications are used to prevent organ rejection and manage autoimmune diseases but may lead to cardiovascular side effects, including hypertension. 7. Stimulants. Often prescribed for ADHD. But they can increase heart rate and blood pressure. Consult your doctor if you notice changes. 8. Herbal supplements. Some, like licorice and ginseng, can raise blood pressure. But many people think they're safe because they're natural. Always check with a healthcare provider. Common herbal supplements that can raise blood pressure include arnica. Often used for pain relief but can raise blood pressure. Ephedra, ma huang. Known for weight loss and energy, but it can significantly increase blood pressure. Ginseng, Panax quinquefolius, Panax ginseng. Used for boosting energy and reducing stress, but it may elevate blood pressure. Guarana, Paullinia cupana. Contains caffeine and can increase blood pressure. Licorice. Can cause significant increases in blood pressure and lower potassium levels. Senna. Typically used as a laxative, it can affect blood pressure. St. John's wort. Known for treating depression, but can interact with medications and affect blood pressure. Yohimbine. Used for erectile dysfunction, but it can raise blood pressure. Bitter orange. Often found in weight loss supplements, it can increase blood pressure. Dong Qi. Used for menstrual cramps and menopausal symptoms, but it can affect blood pressure. 9. Migraine medications. Some work by constricting blood vessels. But this can also raise blood pressure. Discuss options with your doctor if you have hypertension. Some common migraine medications that can cause elevated blood pressure include Erenumab, Aimovig. This medication, which targets the calcitonin gene-related peptide receptor, has been associated with elevated blood pressure in some patients. Beta blockers. While primarily used to lower blood pressure, beta blockers like propranolol and timolol are also used for migraine prevention. However, they can affect blood pressure levels, especially if not properly managed. Calcium channel blockers. Medications such as verapamil are used off-label for migraine prevention. They can have cardiovascular effects, including blood pressure. These medications are used for migraine prevention but may influence blood pressure, so it's important to monitor your condition and consult with a healthcare provider. 10. Cold and flu medications. Many contain decongestants. But they can raise blood pressure. Look for alternatives if you have high blood pressure. Common cold and flu medications that can cause an increase in blood pressure typically contain decongestants. Some of the most common decongestants that may raise blood pressure include pseudoephedrine, phenylephrine, ephedrine, nafazoline, oxymetazoline. These decongestants work by constricting blood vessels, which can lead to increased blood pressure. People with high blood pressure or heart disease should be cautious when using these medications and consider alternatives that do not contain decongestants. 11. Antipsychotics. Used for mental health conditions. But they can lead to weight gain and increased blood pressure. Regular checkups are important. Common antipsychotics that can cause high blood pressure include clozapine. This atypical antipsychotic has been associated with reports of hypertension, although it is more commonly linked with hypotension. Risperidone. There have been reports of hypertension occurring with risperidone use, especially when taken with other medications like selective serotonin reuptake inhibitors, SSRIs. Quetiapine. Though less frequently reported, quetiapine has also been linked to cases of increased blood pressure. Aripiprazole. This medication has been associated with hypertension in some cases, particularly when used in combination with other drugs. These medications are part of a group known as atypical antipsychotics, which are used to treat psychiatric conditions but can lead to increased blood pressure in some patients. Monitoring blood pressure is recommended when starting or adjusting these medications, especially when used with SSRIs. 12. Hormone replacement therapy. Helps with menopause symptoms. But it can also increase blood pressure. Monitor your levels regularly. 13. Erythropoietin. Used to treat anemia. But it can raise blood pressure. Regular monitoring is essential. 14. Caffeine. Found in coffee and energy drinks. But it can temporarily raise blood pressure. Limit intake if you're sensitive. 15. Alcohol. Moderate drinking is okay for some. But excessive consumption can raise blood pressure. Keep it in check. 16. Tobacco products. Smoking raises blood pressure. But quitting can help lower it. Seek support if needed. 17. Thyroid medications. Help regulate thyroid function. But incorrect dosages can affect blood pressure. Regular testing is important. 18. Antibiotics. Some can interact with other medications and raise blood pressure. But this is rare. Always inform your doctor about all medications you're taking. 19. Chemotherapy drugs. Used for cancer treatment. But they can affect blood pressure. Regular monitoring is crucial. 20. Antihistamines. Used for allergies. But some can raise blood pressure. Choose alternatives if you have hypertension. 21. Oral contraceptives. Similar to birth control pills. But they can also raise blood pressure. Discuss risks with your healthcare provider. These medications can help with various health issues. But they might also raise your blood pressure. Always talk to your doctor about potential side effects. Regular monitoring is key to managing your health.